you look at the percent of healthcare costs that come out of your pocket, even with bankruptcy, has actually been slowly coming down because we cover so many more services. We do things in an ineffective and inefficient way. And providers are a big part of that. I mean, the whole Atul Gawande article that was in the New Yorker, if you haven't seen it, you got to read it. It was the thing that Obama said everybody got to read. My class had to read it. Ahead of the game. But what it showed is that in a 30-mile area in Texas, 2 different communities had a twofold difference in how much they spent on health care for identical populations within 30 miles of each other. All right, these are Medicare, so they're covered, same level of sickness, same types of patients, twofold difference. What? Obviously, the care that's being delivered to them is being delivered in very different places. The outcomes are different. Right? That's buying inefficiency. That's poor value care. That's us. That's clinicians. So we bear a big part of that responsibility, not just insurance companies. The insurance companies are in it to not, for profit. They're a profitable company. They employ thousands of people. If we want them in the game, how do you put them in? So what's your goal? Keep them in the game, have people continue to be able to get health insurance, or do you say, over time, what we will do is kind of like the auto industry, they're going to have to shift into other jobs, other lines of business, do other kinds of things. We have a vibrant enough economy that can absorb all of those kinds of things. And I do think that they play an important role. One of the things you do want is a system that continues to innovate. And if there is, because of the profit motive in the private sector and the entrepreneurial spirit in the private sector, we in fact do innovate a lot in healthcare. You would not want to lose that. So if your goal is get everybody in, you got to get everybody in. That's just going to cost you a certain amount of money. Now you want to spend it efficiently. How do you best spend it? Well, you may want to use the market. That's what they did in England. National Health Service comes out of your tax dollar. Right? Everybody's in. But they used internal market principles to drive hospitals and providers to be more efficient. 1 o'clock, 10 hours here, I had a conference call that's coming up. Hope this has been helpful. You need me to come back? Literally, I just got off the phone on one of the provisions that we were working on. And so we actually still do have a house strategy, so we're working on a couple of angles, a couple of ways that you can continue to support things there. We got to get to, we got to talk this. But I hang out on Capitol Hill, get real good, slogging around on there. I'm twice as old as everybody there, but I don't care. Yeah.
Is there, so there's a group of 25 people showed up today, and we had 40 people last Monday. Is there one thing you could tell this group of Penn, mostly nursing students? We're kind of just creating our own agenda here, but is there something we can do by December that's one concrete thing, aside from bringing speakers in to educate ourselves?
You're in a very good position to be able to reach out to your legislators. I think it's really important that every single person, and especially every single healthcare provider, to reach out to their congressperson and their senators and tell them about the importance of supporting health reform. And
if we just say support health reform, is that enough? Because there seems to be so much wrangling within that.
We need to get a bill. Whatever bill comes on the floor has to be voted on and has to be passed. There is no bill that they could possibly pass that is worse than what we have now. Nothing. It's not, what they're going to pass probably isn't going to fix everything, because we're going to do it really incrementally. It gives us a starting place. At a minimum, every single person should be writing to the congressperson. And I think, and at the same time say to support health reform that will really reform how we deliver care. And not just pay for the way we do it, but pay for us to learn new ways to do it better. That's what's really key. Because we're not going to, it's going to cost us more. And we are going to vilify people in the process if we don't all take responsibility. We also have responsibility to lead healthy lives take care of ourselves, take care of one another, and try to lead the healthy lives that we have. If we are endowed with a gene set, that puts us in that position of having a chronic illness. We should not then be ostracized through bad payment policy and bad service delivery. As clinicians, we need to ensure that we are innovating our practices and doing the right things and advocating for the right things and taking a stand on those. That's what's key. That's what I would say. Good luck. A lot of time to influence the process. Let me tell you, even if they pass it, people are already now talking about implementation teams. What are we going to have to do in implementation? Oh, it ain't going away after December. And that's just round one. How do we do it? And that's where we can play an enormous role. Enormous role. Because we're the only ones that can bend that cost curve. The insurers can't do it, big pharma, nobody can. We deal one-on-one. You know, we're the ground troops. We know how to do it differently. And that's what we need to do, and put pressure on it. And use our 2.7 million of us who practice in every single healthcare setting to do that. So, enjoy.
Thank you.